Okay, we can get started. Okay, I want to say hi, everyone. My name is Denise Quayle, and I'm the Managing Director at Kids in Crisis. And this is the Helping Kids Thrive Wellness Series from Kids in Crisis. Kids in Crisis is a 24-hour emergency shelter and crisis intervention program for children newborn to 17. And we maintain a 24/7 helpline, and that number I'll give you is 203-661-1911. And today's discussion on our series is about mental health, physical health, and the resilience of kids and families during this COVID time. The discussion will be recorded, and you can find it in the future on the KIC website. We have a library of all our presentations. Today's guests are Dr. Charles Morgan and Dr. Susan Lasky. Welcome. Dr. Morgan is a board-certified psychiatrist. He's been practicing for over 35 years and has a private practice in Ridgefield. And Dr. Susan Lasky is a pediatrician in Stamford and has been practicing for almost 20 years. So thank you both for joining us today. And I also want to add that if our guests, if any of our participants have questions, you can put it right in the chat box. I'll be the only one that can see them. So, and I'll field those questions to our presenters. So I will start with our first one, and please jump in if either of you have a comment, even if I don't direct it to you. But, you know, for both, and I'm sure we've been hearing this too, we've been hearing a lot about the increase in the level of depression and loneliness that kids are experiencing after a year and a half of this pandemic. And I was wondering from your perspectives, how would you might see how depression would present in a child or an adolescent? Dr. Morgan, do you want to start?
Sure. So actually, I have seen a number of kids, adolescents, so I don't treat young children, but some of the primary symptoms that they come in with or parents report are kids just getting more cranky, reporting feeling sad, not being able to connect with family members or other peers. And some of that was a forced isolation, but in addition, just not wanting to, so we see some social withdrawal. You might also see changes in appetite. They could be either overeating or undereating. And you can also see some problems with sleep. Again, either oversleeping or not sleeping enough. Some patients actually report, or parents report, the kids just being more rejection sensitive. So little things that they would normally handle, somebody not inviting them out to something or a play date, for example, although some of that has been restricted during this time, the level of distress is much more than usual. If they're in school, trouble concentrating is one of the issues that teachers might actually see. A lot of the younger kids will have more physical symptoms. So headaches or stomach aches, for example. Just feeling a sense of worthlessness, that I'm not worth anything. And more seriously, and we should probably talk a little bit about that later, is the kids who are starting to think about, maybe it's not worth being around. Maybe I shouldn't be here. I should die. So those are kind of the things that I see in the kids that I'm treating.
Mm-hmm. Yeah.
I would agree. I think you hit the nail on the head. I will also say I find there's a lot of overlap between some anxiety and some depression. And sometimes in younger children, they will have more temper tantrums or more outbursts that maybe seem like anger or seem like frustration, but are really just a big feeling that's uncomfortable to them and they don't know how to put it into words. Mm-hmm. And it's either anxiety or depression. So I do see that also, and a lack of socialization or wanting to do things they normally find joy in. Mm-hmm. And I don't know if you're seeing, but in some adolescents this year, I've been seeing more cutting and more self-harm than I have in past years. And I think also that forced isolation was a big part of that, and feeling really withdrawn. Now I think I see more the re-entry into being in school full time can be very stressful. Some kids liked not having social pressures or the degree of academic pressures that they have now that are sort of stressing them out as they go back.
Mhm. Yeah, I've heard some kids that are that are balancing being home as almost a relief.
Mhm.
That home remote learning, it made them more tough for them to go back.
I would agree. It's
Yeah,
almost like kids who have school avoidance and then go back. It's very stressful for a lot of them.
Mhm. So,
I think I'm finding that as well, that the re-entry for some of these kids has been much tougher than I think they or their parents expected.
Mhm. That's what I was going to ask as a follow-up. What do you see physically and emotionally about the reentry back into school? And because a lot of the towns didn't provide, they're not offering a remote option.
So I will say,
So
I think it's actually very important that they're back in school. Like, I think that children and young adults are innately social, and it's actually very good for them to be back and have those interactions. But I do feel that I've seen more panic attacks and more anxiety, because not only are there more academic pressures this year, because last year I think most programs, even though I think they did a good job, I mean, here in Ridgefield, I think they did a good job. The academic pressure was still lower because the amount of workload they had was lower. And a lot of schools, the grading systems were a little bit different than normal. But then there's also the social pressure of being near kids and making friends and being in groups, or maybe worrying about kids that have moved on, or people had different thresholds of what they were comfortable with COVID. So some kids socialized and hung out with people, and some kids weren't allowed to do that, right? And so some friend groups shifted and changed. And I think that's an area that's been stressful. I'm sorry, Dr. Morgan, I didn't mean to interrupt you.
no, actually, I think you touched on that whole thing about the friends group. I've seen more distress about the shifts that occurred last year into the summer, and how difficult it is for some of these young people to readjust. High school age kids having a lot of difficulty. It almost seems as if though they've grown chronologically, they're like a year behind. So it sounds almost like some of the middle school issues that you would see around friend groups, and really finding a lot of it distressing. And then interestingly, some of the young people, like I have one senior, for example, who is at this point just kind of giving up on the friend group now, and like, oh, well, in a year I'll be in college anyway, and trying to say, well, you still have to survive for the next year, and how to help him kind of re-navigate becoming reintegrated into those friend groups. So I think that's an important area that we're seeing.
Yeah, absolutely. And I was also thinking the high achieving kids that feel that they lost a year because of the reduction in the academic demands. I think parents were nervous. Are their kids going to be behind the 8 ball? How is this going to look for college preparation? Any thoughts?
Yeah, I agree with that. And I am seeing that, where people are, especially like the junior to senior, right, age group, where they feel that academic pressure because of the year that they're in, aiming towards college, do feel a lot of pressure, and that they're behind and worried about moving on towards college, where the workload is more without the background. And I think just sort of the hit the ground running again of, now I'm in this intense year of school, whether it be junior year or senior year, and I kind of had an easier year last year. I think it's hard because it's a different mindset a little bit, but I agree.
Yeah.
I think another thing with some of these junior and seniors in high school is that in the family background, there's also been some financial losses. And so they're also feeling some pressure to contribute. So by taking on jobs, so they're working, trying to catch up academically and socially. So it's a lot of pressure coming into this year that I don't think last year when we had that return, I was seeing that at all.
I agree. I think the schools were still struggling with how to get through the year with partially remote, partially in person. And now this year it's like hit the ground, as you say, run and let's get going. Yeah. What are some strategies that would help with this that families could use, parents can use, kids can use to help with the return?
I think the first thing I think about when I hear that question is for parents to kind of modulate their own apprehension and anxiety, because kids pick up on that. If we're very anxious, then that's what they pick up on. So that's one thing. I think the other thing would be to be patient. So this is not like any other return to school year. It may take some kids longer to adjust than other kids, and to kind of see the individuality in that. So those are two things that I would say could be helpful.
Mm.
I completely agree. I mean, the way we react to things is the way we teach our children to react to things. And one of the things I say frequently is anxiety is probably one of the most contagious diseases I see. If a parent is really anxious and handling it in a very anxious way, their child, whether older or younger, are going to be anxious. And then I actually have started, even with my little patients, so sort of 3 years old and up, to talk to them about incorporating some mindfulness into their daily routines. Most people feel more comfortable and confident in a routine, and specifically young children, but even older children, if you know what to expect in your day, that's helpful. So setting routines is one thing. And then I tell them, just like you have to brush your teeth to keep your teeth healthy, we have to do some things to keep our brain and our emotions in check. And if you think about it, nobody really ever teaches us how to do that. So, and the younger we learn these skills, the more incorporated they are in who we are. So I usually tell people to start just taking 10 minutes out of their day and doing some deep breathing exercises. I get a lot of eye rolls from my teens about that, but I'm like, if you really do it, 10 big breaths. And I tell people, smell the flowers, blow out the candles, a really big breath in through your nose, a really big breath out through your mouth. It lowers your heart rate. It lowers your blood pressure. Like, it makes you feel calmer. Figure out some form of meditation that works for you. There are a lot of free apps that are awesome that I tell my kids to download, or their parents to download. My littles, I tell them to do it as a family meditation, because a 3-year-old's not going to sit and do meditation usually by themselves. But even a 3 to 5 minute every day, like a maintenance, not even just when you're feeling anxious, but every single day, because we have to practice it to be good at it, not trying to learn it when we need it. Just the same way we have to practice math to be good at math, we have to practice these things to be good at them. And I think meditation is different for different people. So a formal meditation is great, but sometimes yoga might be a better meditation. Mm-hmm. And then some cardiovascular exercise. Actually, I think, there's an endorphin release that happens when you have your heart rate up and you've exercised. And studies show that those endorphins make you feel happier and less anxious than any medicine on the market. Mm-hmm. So even if I tell them, you don't have to join a sport. If you don't want to join a sport, do jumping jacks in your living room. I don't care. Mm-hmm. Or run around your house 4 times, but get that heart rate up, and that will often make people feel better. So I'm trying to have people kind of incorporate that too as strategies for how to deal with some of this stress.
Mm-hmm. Be physical and get out there. And I love blow out, smell the flowers and blow out the candles. I think that's a great metaphor for it. Do you think just being back at school in itself will reduce the feeling of loneliness? Because it seems to be a commonly heard thing that people are feeling more isolated and lonely. Is just being back at school going to help that?
I think it's going to help a lot. Teachers play a huge role in kids' lives. Their peers play a huge role. And so I think that will reduce it. But I think another part of that is intergenerational connection. Asking our kids to reach out to grandparents who, for some of them, have not been able to visit during most of this past year. Even getting on a video chat, how important that is. I've actually encouraged some of my young people to start going back to writing letters, because, you do text messages, and there are these very brief telegraphic messages, you don't really get a sense as to how someone is thinking. So I encourage people to start to write letters. The other thing that I've talked to some of these families about is doing some kind of a reading activity together, whether it's poetry or prose. And it doesn't have to be an extended period of time, just some time together. I love to eat, so I also encourage families to cook together, to prepare a meal. Everybody can have a role in doing that. And it just creates up such connection and conversation while you're doing that.
Mm-hmm. A sense of community in your own house.
Yeah.
I love that.
Yeah, I think that's wonderful advice. Yeah.
Absolutely. And I love writing letters. So, you know, literally, we've been hearing so much about physical altercations at some local Board of Education meetings around our area over the issues of masking. Many of these arguments happen between parents, but are happening oftentimes in front of kids about whether or not to mask, or a mask and not mask debate. What do you think about that? What guidance would you give to a parent that is in a debate about whether the school's requiring masks or not?
So I will once again say the way we react to things is how we teach our children to react to things. So I think there's one thing about having discussions and questioning and having feelings, and there's another about being physical and angry and getting into fights, whether yelling or physical fights. And I think that, you know, the way you react to it is very important, especially, you're right, children are very aware of the world around them, whether they actually are there and see it, or whether they see videos on TikTok or, you know, of these Board of Education fights, because that's where they see everything, right? They see everything that's going on in the world. And if there's a lot of anger and a lot of fear and a lot of stress around those things, the child is going to feel a lot of anger and a lot of fear and a lot of stress around those things. And, you know, the cases of COVID have really, with Delta, have really gone up in children. And there's really, in the medical world, no debate about whether or not masks are safe for children. They really are. This is really more of a political discussion and sort of that state of the world that we're in. But I think it's important to have these discussions with the kids about why it's important to keep them safe. I tell people with young children to practice wearing masks at home with their children before school started. I was saying over the summer, have movie night with masks, or play a game with masks, play Monopoly with masks for a half hour, just so they see you in a mask. They see that you're comfortable in it. You can do something fun in it. We can laugh and see our expressions in our eyes in a mask, right? And children read cues from lots of different things, not just the lower half of our face, right? So even visually impaired children learn communication and language at the same rate as their peers. So the idea that this is affecting development is really not a concern. And they're not masked 24/7. So they're having social interactions with family and friends that are unmasked. So I do think it's really important that we react appropriately, so we teach our children to act appropriately.
I think also parents have to really think about how their kids view them, so that when we start to label other people and create them as enemies, it's so much more difficult to have a conversation as to say, well, you know, we have a different point of view. Let me hear how you have come to the conclusion that you have come to. Makes a huge difference in terms of how we disagree with others. We don't have to be disagreeable. And I think that's a lesson that we can teach our kids, whether it's at a board meeting or at a family event, because those kinds of things happen. We're not always going to agree. And as we've all seen, the science sometimes seems confusing, trying to figure out what goes from one week to the next. So to say, you know, last week I was so convinced this was right, and this week I'm not so sure. It's okay, so that your kids start to get the sense that we can live in uncertainty together. We don't have to be either on the right or left. It's an and or you know, situation most of the times.
Yeah, I think that's an incredibly good point. Yeah, I think you're right. And things can be fluid, right? I do find the kids don't seem to mind masking. I mean, even the little guys, like I have 2.5-year-olds sit there in my office with masks. And when I say, can we take this mask off so I could see your whole cute little face? And they look at their mommy like, can I take my mask off? So they're really okay. They don't seem to mind. And yeah, but I think your point is very well taken.
Actually, what you just said reminded me of a story I saw this week. There's a 6-year-old who was supposed to be getting a class photograph, and the photographer could not get him to take his mask off because he says, Mommy says I should keep my mask on except when I'm eating. So his class picture, he has the mask on. And it just reminded me of how, especially at that age, how important adults are to kids in terms of how they see themselves and how they should behave.
It's so cool.
A perfect school picture for this year, for sure. And a lot of the comments in the from our listeners as how adaptable children are, that they almost seem more adaptable than we are as adults. We might feel more uncomfortable with a mask than they do.
Yeah,
absolutely.
I think that's very true.
But along those lines, in terms of the stress of all these difference of vaccinating, not vaccinating, mask, not mask, what do you think the long-term effects are for our kids?
In terms of the stress around all of these debates?
What these debates, vaccines, boosters, masking, do you feel like this is going to go well beyond this pandemic?
I do think that there's, a lot of stress around these issues. I hope as things lift, and I do think we have a good chance of COVID becoming a seasonal nuisance over time, and not really, it's not going to be a pandemic forever, right? There have been pandemics before, and they usually run for a certain amount of time. So I think one of the things is to talk about that this isn't forever, right? So I had a family yesterday that was sort of saying how overwhelmed they were about that we're still in masks, that we're entering cold and flu season. Are we always going to be in masks? And we're not always going to be in masks. And I think that I don't know how long it's going to be. And I think that's okay to say. And it felt like we were coming out of it in the spring, and now it doesn't. And that's hard to take for a lot of people. But I think one of the things to point out is that this isn't going to be forever. And I think it's important to have that conversation with the children that are sort of struggling with it, or with anybody, that there is going to be an end to this. In terms of vaccine debate, I think it's similar in terms of mask debate. And, I think it's true. I think sometimes people have a hard time teasing out the science behind this, and who to trust and who to ask, and what to believe, especially in the age where we get information from so many different places. And people really, I find, don't know how to tease out what's reliable information and what's not so well. So I would tell you, to trust your primary care provider. Like, these are people, myself included, who've dedicated their whole lives to taking care of children. I have no interest in making recommendations or hurting a child or giving recommendations about things that I don't understand. And for generations, we've trusted doctors. And I think it's very important that people really kind of go back to that and not believe things that they're reading on Facebook when you don't really know the source. People put all sorts of things up there. So I think that's a really important point.
Very, very important, especially when the information seems to be changing often.
Absolutely. And, I think it's okay. Like I say that often, I know this is confusing. This is what was said last month. And now we're here because we're learning as we go with this virus. And science is learning about it too. And, things have changed. And I do think that's jarring for people. And I think it's really unsettling for some people. So
I agree.
I totally agree with what you just said.
Yeah, absolutely. What would you suggest for parents that are maybe on different pages about that? They might not be on the same page understanding whether they are in agreement whether their child should get a vaccine, or when the booster comes out, I'm going to get it or not get it. How do parents navigate that world of just not agreeing, and it has an impact on their kids?
That's really where I think having a trusted medical provider have that discussion with the family, because you choose a doctor or nurse practitioner, whoever you're, or it could be a mental health provider, because you have trust in their skills, that they're looking out for your well-being, and they're neutral. They don't have a vested interest in one side or the other. They're going to follow the science and explain it to you, hopefully in terms that you can understand, so that you can make a good decision. I think so much of what's happened is that people get into shaming whatever the other side is, whether it's masking, not masking, vaccinating, not vaccinating. And again, we use terms, anti-vaxxers. You can't have a conversation. It's a shutdown right there, right, as opposed to let's talk about what are the issues you have about getting the vaccine or not getting the vaccine. And I really encourage people to listen to each other and be very careful of the words we choose when we have these conversations.
I completely agree. And I think that people, it's true, people shut down so quickly with some of the language that people are using, or I'm on this side, you're on that side. I find that parents parent differently, right? So about lots of things, that's something I see a lot, where it could be not about a vaccine or a mask, but even about how to put your child to sleep, right? Some mommies want to sleep with their baby or rock their baby, and or daddy, and vice versa. The other one's like, just stick them in a crib. And I find that we have to have open, honest conversations. And I agree, come to your healthcare worker and have those discussions, because just like I can talk to you about how best to get everybody sleeping, I could talk about how best to keep your child safe, and educate everybody on the situation and what works for them and what works for their family.
Absolutely. We have a question about more of a step in the anxiety area of a panic attack. What is a panic attack, if you could define that a little bit? And what if I'm worried that my child is having one?
Oh, a panic attack is fear that's sudden onset and overwhelming. So just to talk about fear a little bit, we've probably all of us at some point have come up against something that we're frightened about, and you'll get a fear reaction. The way I think of a panic attack is not having that object or person or thought that's frightening, but that you still get the same sense of reaction, that overwhelming sense of fear. And it just takes over your whole system. It affects you both emotionally, cognitively, and physically. So from a physical point of view, people can feel that they're getting chest pain, they're having choking sensation, they're short of breath, feeling dizzy, having gut symptoms, especially it could be diarrhea or cramping or hurting, sweating, all tachycardia, your heart rate going up. All of these things are preparing you to run away from danger. In this case, there is no physical danger that you need to run away from. Hot flashes can occur. The feeling of losing control, of losing one's mind, is probably the most prominent one. I had a kid who talked this past week about getting a panic attack while he was doing a test and had to literally run out of the classroom, because that's the sensation you get. You want to run away to get away from this feeling. I can't keep still. In some very severe instances, people actually feel detached from themselves, as if they're watching this happen. And in extreme cases where people blow off so much of the carbon dioxide because they're hyperventilating, they can start to feel tingles in their fingers, in their toes, and people think they're going to have heart attacks. So with a panic attack, it feels very physical. They're thinking, I'm going to die, something bad is going to happen. I need to get away from some of the cognitions that occur. And if untreated, it could happen just once, but if untreated, you can get what we call panic disorder, where now you're starting to worry that this is going to happen again. So one of the things that I teach people to do is very much the idea of focusing on the breath. Because if you can start to slow your breathing down, and I actually have them do box breathing, which is a little bit, I like this smell the flowers and blow out the candle one. I think I'm going to use that one more.
Go ahead. Yeah.
Because I've been teaching box breathing, where some of them have a hard time dealing with, which is, take a deep breath in, hold it for like 4 seconds, then wait another 4, and then breathe out, and then hold it again. And I like yours. It's so much more simple and direct. That's why I love pediatricians. You just break it down. So I'm going to steal that one.
Go for it.
It really helps, because once you start to breathe slowly, your heart rate starts to slow down, and there is no danger. And beyond that, you can then start to teach people that these are just signs of anxiety that will go away.
Yeah. And a follow-up to that a little bit, someone asking, what if their child is having an onset of all of a sudden twitching and becoming twitchy? What would a parent do to address that?
In the setting of a panic attack?
I think so. Yeah.
Okay.
Maybe.
So that is, again, it related to the tingling that you get. Is that blowing off of too much CO2? A simple thing that I ask my patients to do is to just rebreathe through a paper bag. So you put a paper bag, cover your nose and mouth, breathe in and out. You start to build up the CO2. That will go away, because that's the thing, is that you start to say, now I'm going to have a seizure. So you just kind of get the cascade getting even worse. So just the breathing is going to help with that. And the rebreathing.
Yeah.
I also often tell people to try to ground themselves when they're doing that, like sit on the floor or have your feet on the floor if you're in a chair, with your hands on your lap, so you feel really secure, not like dangling from a high chair or something like that, where you just sort of secure yourself in a spot. But the breathing is really paramount. Sometimes I think when somebody's so panicked, it's hard for them to bring that breathing down, but it is what sort of gets them out of it. I am seeing a lot of what you referenced, which is that I had a panic attack and I'm so afraid it's going to come back, because I hated that feeling so much that I'm afraid of that feeling. And so I reiterated, like, just doing some of those daily sort of mindfulness routines that I said as a way of sort of preventing them. I also tell people it's kind of, panic is very sudden, the way you just described absolutely perfectly. But I always tell people to learn to see the anxiety coming, right? So when you can't see me standing up, but I often point to like my ankle and say, because when your anxiety is just at the level of your ankle and you see it coming, you can make it go away pretty easily, just like just like a headache, right? You kind of feel like, oh, my head hurts, but it's not that bad right now. And if you drink your water, or you have something to eat, or maybe you take some Tylenol, you can make your headache go away. But if you wait until it's a horrible headache, it's much harder to get rid of it. So if you wait until that anxiety pops up to the top of your head and is spilling out of the cup, it's much harder to bring it back down. So and children aren't really good at always knowing their feelings. They don't necessarily know they feel anxious. They just know they have an unpleasant feeling. And sort of recognizing that, or even having a word for it. So with some of my young kids, I'll refer to an area of their brain. I say, you have this little tiny blueberry-sized part of your brain that I call your worry brain, right? That's your worry brain. And he can act like a schoolyard bully, right? He thinks he's the boss, right? Of your cantaloupe-sized brain. And you sometimes have to just say to him, worry brain, like, I'm not going to feel like this right now. Or maybe mommy says to you, I think I see your worry brain today, and I think you should tell him that he's not allowed to come to dinner tonight. And that's a very something a child can see. It's very concrete, and a lot of young children are very concrete, where they can sort of see a piece and they can kind of say to it, like, I don't want you here, I don't want to feel like that. And that kind of sometimes helps them recognize that feeling as it rises.
I like
That's the
catching
best
it early.
description. That's the best description of self-talk I've heard.
Oh, thank you. Yeah, worry brain. Yeah.
Well, I
love
like
it.
catching it early. It's like hydration, you know, it's if you're already past that point, you want to hydrate early.
Yeah.
And I'm thinking with this twitchy question that if the twitchy is the start of it, grounding yourself as you described, I think is a good way to
Mhm.
start addressing it early. I think in both of your practices, I'm sure you do a lot of assessments and make referrals out when needed. What is a time that a parent should be looking for professional help? And what type of professional should they look for?
Well, I probably usually refer to him. Most of the time, people usually come in pediatrics anyway, maybe not always in adult medicine, but often will reach out to their pediatrician first.
Yeah.
And I always tell people to reach out to me if they're worried about something, whether it's about something emotional or something physical. If you're sitting up worried about it, then it's worth a phone call. And so if your child is starting to either have panic when you're seeing panic or you're seeing tics, I didn't know if that twitching was related to tics, because tics can sometimes be a sign of anxiety also. They can occur for other reasons as well, but if they're related to anxiety, or, you know, not engaging or feeling sad or staying in their room all the time and not coming down for dinner, whatever it is that you're worried about, to reach out. I usually see my own patients initially for anxiety and depression just to gauge how significant it is and talk to them about some tools. And often, you know, depending, but usually would refer for therapy depending on how significant it is. And then also to psychiatry, especially if it's, you know, something I think is going to need to be medicated. I would have told you if you had asked me 3 years ago, even about prescribing antidepressants and anti-anxiety medicine, I would have told you it wasn't something that I was really comfortable doing or wanted to do. But COVID has changed that, like it has so many other things. So if it is something straightforward, where I really feel it's a child that's having anxiety that's crippling or getting in their way, but there isn't other things going on, or depression where I'm not worried about suicidality or a comorbid diagnosis. So sometimes these things go with other things. So if I'm worried somebody has a personality disorder or bipolar disorder, that is not in my wheelhouse and it's not appropriate for me to treat it, then I would always refer. And I often will also just refer, sometimes just, you know, to for the family to feel secure with it, as well.
Mhm. Thank you. Dr. Morgan, what would you say?
So the other thing that I would add is that I always want to make sure that there's not a physical problem underlying
True.
whatever we're seeing. So that's why it's good to collaborate with a pediatrician around care of children and young adults. Because sometimes it could be thyroid, it could be other problems that they're having that need to be worked up and could be treated differently than, so therapy won't necessarily help the underlying issues. So we need to be aware of that. In terms of who to refer to besides pediatrician, I'd say a good nurse practitioner. It could be a social worker, anyone who is going to be willing to talk to the child, adolescent, and the parents. I think you cannot get enough information by just talking to children. So anybody that I see, and I only see 16 years and above, I ask their permission to get their parents involved, because their perspective or even the language they use may be different. And having the two of them in the room together, you get a real sense of what's going on, as opposed to even seeing them separately. So for the initial evaluation, I'd say choose someone who's going to be willing to see both I treat the family as the patient, maybe the best way to put it.
Mm-hmm. I like that, because you're both outlining someone that's looking at the whole child, you know, at home, physically, emotionally, the whole package, and including family, I think is a great way to go about that.
And sometimes getting information from teachers as well, really important. And so that will get filtered a lot through the parents, but getting that perspective is also very important.
Mm-hmm. You know, you touched on earlier, Dr. Morgan, about the concern about a child being at risk, and that kind of opens up a more urgent kind of response. What would you say if a parent is concerned, maybe there's some behaviors that they feel that their child might be unsafe with themselves?
So the thing I look at, self-harm behaviors would be an issue that I'd be concerned about. Persistent depression and social isolation. If a kid is talking about suicide, I think for a long time, many people, including some professionals, thought, or if they talk about it, then they don't really want to do anything. Talking about suicide is actually one of the indicators that that's going on. If you see more risk-taking behaviors, so a kid who is driving, for example, speeding more, getting into accidents more, a lot of focus on negative, morbid thoughts would be stuff that I'd be concerned. And even if they're not talking about suicide per se, but focus on death, dying, dark thoughts would be some of the things that I'd be concerned about. And at that point, I'd be reaching out, depending on how serious, I would say, start with something like a 211, calling that number, or 911 if it's imminent, but you certainly want to get an emergent evaluation. The other thing I should mention is kids giving away favorite possessions. That's one of the hallmarks that I always ask about, with kids giving away favorite possessions being a sign of suicide. The one other thing I would add is that for adolescents, you may not get so much of that warning. So I talked earlier about rejection sensitivity. It could be just one event that brings on this whole cascade. So you can go from things being okay to, an angry text that says, I don't want to talk to you anymore. That leads to this. And if the person starts talking about suicide or is very upset, get an evaluation. You can't go wrong by getting this evaluation done.
Absolutely. Someone is mentioning also they have a young adult daughter who has anxiety, and no matter what, cannot seem to talk herself out of it. What simple techniques? We mentioned a few already about mindfulness and grounding and breathing. Anything that for someone that's really struggling with getting out of that vicious cycle?
Well, I would say, and I don't know, they may have done this already, but I do think it's very important that that child sees their physician, because, I agree that some physical things would also need to be ruled out, just to make sure there isn't a cause for it that would be treated differently. And then, a referral, not only for therapy, but maybe to discuss some treatment if that is happening frequently and it is really impacting their life. I'm hoping that the stigma of treating the mental illness is decreasing, right? And that I find that I have two teenagers, their generation is much more open-minded than mine was when I was that age, right? Where just the perspective of how we see it, I think, is different. But to definitely seek some treatment, I think would be very important, besides some of the other stuff that we said.
Absolutely.
I think your point about the stigma is an important one. So somebody like a Simone Biles, for example, would have never happened 10 years ago.
True.
And I think kudos to her for actually bringing it to the forefront. One of, I think, the silver lining of COVID also is more recognition of emotional, mental problems. When COVID started, much of the focus was on the physical. And I think what we're understanding is that the medical footprint is only a fragment of what the emotional footprint is. And it's allowed much more conversation. And so people are more willing to have these conversations and to seek help.
I agree. I agree. I think people are more open and receptive. You hear people that have said their child has never dealt with anxiety before, and all of a sudden it's never been a part of their family profile. And now COVID has changed that. So,
Yep. And, adolescence in general is a time where a lot of people struggle with anxiety, trying to figure out who they are, or depression or sadness, between the ages of 12 and 20, that's common. And I think that this allows us to have that conversation, because I think with COVID, it's more common. And so a lot more people feel comfortable asking those questions. I often start my visits by reminding my adolescents and that, I'm not only there for their physical health, but for their emotional health. And I just put it out there because I think it's important that they know it's okay to have these conversations. It's actually very important because our emotional health impacts our physical health, right? Yeah. And so I agree. I think that's true. About this suicidality, I just wanted to add one thing, that I think it's also very important to know it's okay to ask that question. I think a lot of people are under the idea that I don't want to bring it up because I don't want to put an idea in someone's head. And that's not how this works. You're not going to give them the idea of, when you say, are you thinking about hurting yourself, or have you been hurting yourself, for the person to say, oh, that's a good idea. It's usually already in their head if they're suicidal. So it's good to bring it up and ask the question, because likely you'll get an honest answer from a child or a teen.
Definitely. Great point. Great point.
Absolutely. A very good point. I think people are afraid to touch on it, thinking they'll open Pandora's box, but actually.
Yeah.
Yeah. There's still, even though school is well underway, people are mentioning there's still a lot of frustration and anger from our parents about the kids not having a remote option, and that they're not feeling safe returning to school, and that what are the physical and emotional concerns that parents should consider if their kids are not, being forced to go back to school. A lot of parents feel like they're being forced and they would have chosen a remote option.
I think for most children, it's probably honestly better for them to be in an academic environment. I think if there are specific medical situations that make it unsafe for a family, for example, a parent who just had a bone marrow transplant, or and is very immunocompromised, or a child that is, has cancer and just had a bone marrow transplant, I would say to definitely seek out accommodations, either through their primary healthcare provider writing a letter for them, or through their school, of what kind of accommodations to keep that child physically safe, or that family physically safe. I think for emotional reasons, almost all children should be in school. It's very rare that it's better for somebody to get a homebound education and not have, and I'm not talking about homeschooling, that's different, but a homebound education because of COVID. And I think it can become a slippery slope where it increases anxiety and social isolation. And school avoidance is a real thing, where the longer they're out, the really harder it is to get them back. So I think for most people and most families in the current environment that we're in, and in Connecticut, because I'm just speaking to where we are here, where our schools are masked and our vaccine rates are high. And, for the most part, I think we've really shown that in-school transmission of COVID is very low, because we're mitigating. If I was talking about South Carolina or Alabama, I might have a different discussion where people are not masked, but here, we're working hard to keep people safe. And last year, when we didn't have vaccines, we still really did a good job of low transmission in school environments, because we're following guidelines in those places. I was finding that people who got COVID mostly didn't get it in school. It was usually through other avenues, socializing or out in restaurants or things like that, where they ended up getting it. School is actually pretty safe.
Yeah, I think feeling.
I was going to say the benefits emotionally and socially of being back in school far outweigh the risks. So
I agree.
I totally support that.
Yeah. I mean, last year, I would say I could walk into a room in, say, January, February of last year, And I could tell you before the child even opened their mouth if they were full remote or not. They were so flat and sad. And as soon as we went back to school, that energy just really changed and lifted. So it is really important that they're there.
Building that back, relearning how to socialize. You heard a lot of kids say they forgot how to make friends and to have conversations and how to interact. If we could step back to the concerns about safety and suicide, one of the questions are, would you find that most suicides are planned, or can they most often be very impulsive acts?
Oh, for adolescents, it can be quite impulsive. And again, I don't work with smaller children. For adults, young adults, it's much more planned. But for adults, it can be very, very impulsive. It could be just one insult to add to something else that can tip them over the edge. One of the statistics, and I can't remember exactly, is that most people have seen a health professional within 30 days of their suicide attempt. And so the question about asking about emotional well-being during regular visits with primary care is such an important thing. I'm not sure where the PHQ-9, what age group, I think it starts at 16, but it's a screening device now for depression that you'll see in a lot of young adults and adults getting in their primary care offices. Very, very helpful to start the discussion because it's non-threatening, and based on the score, then you can go on to have a further discussion. So I think we can actually do a very good job of screening for suicide with a large part of the population. Like I said, with adolescents, it can be impulsive.
And we start using it at 12, actually, and there's some discussion about dropping it down to 10.
Wow.
Yeah.
Wow.
But I think, currently we started at 12. Yeah.
So you would start asking from 12 years and up about emotional well-being and do that screening?
So we do a screening. It's a sheet of paper with very specific questions on it that's handed to everybody 12 and up that they're supposed to fill out on their own. We ask their parents not to help them, and they fill it out, and then it's given to us before we walk in the room so it can be scored. So you have an idea of where that person is emotionally. They've shown that most people answer surveys very honestly, and kids particularly answer them very honestly, as opposed to sometimes a question and an answer from an adult. So it's a really good screening tool, because even if it's not blaringly positive, where you're very concerned, there are often soft signs the way they answer questions that you have to ask more questions and take it a little further.
That's very helpful. And to be doing it maybe even younger at the age of 10 soon. I wonder how much of that is COVID related too. We're seeing so much more.
Right. Yeah.
One question is also, what can teachers do to help high school age kids to overcome the issues of feeling socially awkward returning to the classroom? And I think we've all heard a lot of that about kids having to relearn being in that group environment again, and maybe they haven't been in touch through social media with their friends.
I mean, I think having some of these discussions at the beginning of class or doing icebreakers are a good idea, or having kids, especially high school age kids, do group projects, right? Because it's very easy to kind of just stick to yourself. But if you're forced into having to talk to other people or work with other people, you might be nervous for the first few minutes or the first time you meet, but I think that helps people get over it a little quicker, or meet new people, right? Because sometimes maybe you did lose friendships, or friendships changed during COVID when we weren't able to be social, and that's kind of a way of getting people to meet new people in classrooms. That's how we make a lot of friends, right? Meeting people in situations like a classroom or a job or things like that. So just having them interact with each other.
Yeah, and I think a lot of kids think that other kids were together when they weren't there.
I think
I think they imagine that, oh, they've missed out on so much, but actually those kids probably haven't been seeing anybody either.
Right. Yeah.
And I also think that if teachers can talk a little bit about some of their difficulties returning I think it could be helpful. I've worked with teachers this past year who had to do remote and then quarantine and back to school, who had real difficult time. And I think if they could make it part of the human experience of going back to an uncertain future, it would help a lot of the kids to ground themselves.
Mhm.
That's an
It's a
excellent
really good
point. Yeah.
I think that's great because the teachers are struggling too. We're all human in this, and they're back and, feeling how they're feeling, and they have children maybe themselves that are dealing with the same thing. It's a really good point.
Yeah, that is. And, we all want to see ourselves in other people, right? And realize we're not the only one feeling a certain way or going through something. And I think it's such a great point, because especially for a kid to see an adult being able to say, look, this was hard for me too, right? And I'm also worried and scared. It humanizes it.
Yeah.
Absolutely. Absolutely. Any closing thoughts or comments that you didn't get a chance to say, or a strategy that we didn't mention that you'd want to cover?
I would say, I think communication and open conversations are probably the biggest thing we can do for each other, right? As people in general. And, a family night, the way Dr. Morgan said, whether it's cooking or playing games, and having open communication, talking about our feelings, talking about our good days, the things we're excited about, and the hard things, the things we're afraid of, the things we're worried about, is crucial. And how we learn to deal with things, and how we cope with things, and how we realize that we're strong and capable, right? And so I always tell people, we all kind of create a comfort zone or a comfort bubble around ourselves, a place we feel safe. But where we grow the most is often when we step outside, when we push ourselves just outside that comfort zone, and we say, I'm afraid to do it. I'm afraid to push myself there. But you know what? I'm gonna try, right? And so I think the more we communicate that, and the more we have those conversations, the more likely people are willing to do those things, and then realize, look at me, I'm standing outside my comfort zone, and I'm fine, and I am strong, and I'm capable of this. Not leaps and bounds outside of it at the beginning, right? But just a step. And I think that's really important.
Very helpful. Very helpful.
Yeah, I think you're stressing the point of growth through adversity is a good one. I think the only thing I would add to that is, when this first started, we had this idea that we can get through this together. And as it's gone on for a long period, I think many of us have forgotten that. And I think if we just reestablish those connections and see each other as part of the human family, going through this together, that we can actually make it. And it's a part of building resilience that way.
It's a great point. I agree. Feeling like you're not alone, you're in it together, and keeping the lines of communication open about how people are feeling about it. That's great. Well, thank you both so much. This has been so helpful, and people are just sharing that in our chat box about how helpful this was. So I really appreciate you sharing this and the time you spent with us.
Thank you for having us.
Yeah, thank you for having us.
Thank you so much. Good luck. Have a great rest of the week.
You as well. Take care.
You too.
Bye.
Well,
Bye-bye.
bye-bye.